I think it's huge. And, in my experience, when I work with clients who have these kind of functional GI issues, and, a lot of them are also working with functional medicine or nutrition and doing really good work with that. But when we get those viscera moving and moving in the right positions and orientations, we really see some positive gains.
Oh, man, that is just so huge. All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. And Shed Light Cold Lasers has been a game changer for us at HML professionally and personally at home. Personally, on a personal note, I had a very bad bout of vertigo, and I got probably 85% there by going to a few different functional neurologists over the years to help me out with it. Then I bought this, and this is a game changer because, one, it's portable. That means I can take it to the office, use it on patients all day, make sure it stays charged, come on home, and then throw it in my pocket and use that home. And this is what cleared up my vertigo. Now, professionally, the way it's been the game changer for us in the office is that it has cut our results down by 50%. This can get used on just about anything, any disease disorder that you can think of, it can pretty much get used on. Now, as far as how it has helped us out, it's cut everything down by 50% on our times. So when we're working with our kids with special needs, when we're working with our chronic neurological disorders, autoimmune diseases, to get those people into a good point that they're happy and that we're happy, times have been cut by 50%. You will definitely want to go check out shedlightcoldlasers.com or email Griswold at shedlightinformation@gmail.com, 518-338-6658. Well, all right, everyone. Welcome to the Dr. Alex Show. And today we have a pretty fun guest on. His name is Dr. Oberst, Seth Oberst. Dr. Oberst, did I pronounce that correctly?
You did. Yeah,
Just
you
want
nailed
to make
it.
sure.
You nailed it.
So, as a lot of people know, Dr. Lauren, my wife, and I are part of IAFNR, International Association of Functional Neurosciences and Rehabilitation. I think that's what they're calling themselves nowadays. They've changed their name a couple times since we joined. Anyway, he gave an awesome presentation about breathing, and he's going to go into a lot of information just about how breathing affects not only our biomechanics, but our brain function, how it can affect our health as a whole, how to identify some aberrant breathing on yourself or maybe even someone you know. And we figured it'd be just a great episode to talk about all this. So, Dr. Oberst, thanks for coming on.
Thanks for having me. I'm looking forward to getting into it a little bit. And I so appreciate what you guys are doing.
Oh, it's much appreciated. What I kind of wanted to start with actually was get to know you a little bit. What got you into the field you're in, and what led you to where you're at now?
Yeah, absolutely. Well, so I'm a physical therapist, and I've got my own practice in Atlanta, Georgia. And I started out working after graduating physical therapy school. I wanted to work with athletes, and so I did a residency in sports therapy, and I found that rewarding. But I also found that there was a lot missing, and a lot of times there seemed to be a lack of translation from what the person could do or could not do on the table to the field. And what I found was I was seeing the same patterns in the folks that I saw kind of more in the middle of the day, who are the non-athletic folks, the regular kind of more chronic persistent pain type scenarios. And I was really drawn to that. And because I found that they had problems that no one seemingly really could fix. And it felt really important, right? It's one thing to help a baseball player throw a little bit faster, a football player run a little faster. But I thought that it's another thing for someone who's got headaches for 20 years to finally be able to do their job without having to take 12 aspirin a day, or someone who couldn't sleep at night to finally be able to sleep. And what I found was in the course of my study that a lot of this was stress related. And, I couldn't figure out, why can't people relax on the table? Is it me? Are they nervous about me? Are they nervous about being here? Or is there something a little bit more fundamental? And as I was going through and I started to really look into the neuroscience of stress and what happens to the brain when we're stressed, And then there was a really natural transition from what happens to the brain when we're stressed to what happens to the body when we're stressed. And one of the main connecting factors between brain and body, of course, is the breath. So it would make sense that how we are breathing is affecting both our body and our mind, and is both influenced by stress and an influencer over stress. And then, from there, it just continued to grow. And I really started to look at the upper airways and what happens with our occlusion. So how our teeth touch, and the position of our jaw, and the position of our cranium, and our tongue, and our lips. And all of these things, together create how a person breathes, and ultimately how they move. Because, as I tell my clients, we take 20 to 25,000 breaths a day, and we will always sacrifice our body's position in space to help us breathe. It's the first thing we do when we come into this world, and it's the last thing we do when we leave. So how we do it matters.
Wow. I think probably the most profound thing you said there is for everyone to probably take home right away is breath is controlled by stress, or partially dictated by stress, but then you can also help control your stress with your breath.
Absolutely. Yep.
Meditation, controlled breathing.
An easy thing that you can try is if you have someone, if you just think about taking your arm and moving it internally or externally, or raising your arm up overhead, and then you take 20 or 30 very rapid, stressful breaths, and then recheck that range of motion, you'll often see a change in that range of motion, because you're changing the orientation and position of the rib cage and the pelvis. You're tonifying, increasing tone to muscles potentially. And so, yes, how we breathe absolutely influences how our body moves, and how we move influences how we breathe.
Yeah. Well, I'm thinking, if you don't mind, let's hit Nerdville and kind of work our way up.
Sure.
So with, I guess from the bottom up, does breath affect, let's say, the positioning of our feet, the postures of our legs? Or are we talking mainly torso up?
No, I would argue that it does influence the position of every part in our body. When we breathe in, we have to have a consummate expansion in our body to accommodate the airflow that's coming into the torso, right?
Yep.
And so all parts of the body will expand or rotate outward to varying degrees to accommodate an inhalation. The opposite is true. When we exhale, our body rotates more inward, right? So we expand and then we compress, right? And so if I adopt a position of my pelvis to accommodate potentially the movement of my viscera, my guts, down into the pelvis, right? I may position my pelvis forward or to one side, right? To accommodate that movement. Then I will, by nature, if I'm changing the position of my pelvis, I have to change the position of the hip joint. If I change the position of the hip joint, by definition, I have to change the position of the knee joint. If I change the position of the knee joint, then you can kind of see where I'm going. I have to change the position of the tibia and the fibula,
100%.
which then orients the calcaneus and the subtalar joint, and then ultimately the arch into an internal or externally rotated position.
Sure.
When there is and that's normal. Our body should accommodate breath by rotating outward and inward based on the breath cycle. When we look at, the most common compensation that we see at the pelvis with breathing is a anterior or forward tilt of the pelvis. So the pelvis goes forward, right?
Creating what some people call sway back.
You could call that, or excessive lumbar lordosis, an increased arch of back. Yep. But all of them, that's the most common compensation that we see, is that pelvis moves forward. Now, you may see it move forward more on one side than the other, or both sides may go forward, depending on a person's kind of structure and their demands on them. But that's gonna orient the femurs closer to the pelvis, right? Which is going to change internal and external rotation at the hip joint, which will then, of course, change how the foot goes into, what position the foot goes into. Sure. And then if we extrapolate that into walking, which is, I would argue, the most fundamental human, it's a very fundamental human movement, right? It's locomotion, bipedal. And so if my pelvis is oriented forward, I'm not going to be able to get my hip behind me because I'm relatively in flexion.
Yeah.
So I'm going to lack hip extension. And so we need that hip extension in order to propel us forward. So if I can't get it from my hip, I'm going to get it from my foot or my lower leg. Right.
Absolutely.
And so there's all these compensations that occur. And I would argue they arise from, at least in part, the strategies that we have developed to help us keep an open airway.
Love it. Now, one of the things that come to mind is, this might be different. What do you think of dancers and gymnasts? Because they are the most lordotic people walking around. Is that because of what they do?
Well, so if we use the example of gymnasts, right? So one of the strategies that they will use, and these are all, by the way, subconscious strategies. They're just trying to problem solve, right?
Sure.
And figure out how to stick a landing or perform certain movements.
Yeah.
But one of the things that has to happen is if I rotate the pelvis forward, far forward, right? I'm very stable in that position because my vertebra, my lumbar spine, are all extended, and the facet joints are pushing against each other. So it's very mechanically stable.
Yeah.
Right. So if I'm stable there, then I can create a tremendous amount of pressure in my abdomen to generate enough force to jump, sprint, and twist and turn, right?
Yep.
But they may not be getting it from the ideal physiological positions. So what you've seen is they basically have reduced degrees of freedom in their back to create stability. Yeah. And then the excessive motion that they have to get, the excessive flexibility to perform splits, et cetera, they're going to probably get, in my experience, from overstretching their joints.
Yeah. Makes sense.
Right? So they basically give up certain freedom in certain joints for stability, and then they gain that excessively in other joints for mobility.
Sure.
And that makes sense, right? I mean, if you were to X-ray and MRI some of these backs in gymnasts, even the really good ones, you're going to see lots of spondylolisthesis. Spondylolysis, right? Which just basically means those vertebrae are shoved forward almost pathologically, right? You may even see some fractures. The body would rather break bones in the back than lose that stability in the back.
Yeah.
Right.
Yeah.
And that may work for some of them, right? That allows tremendous amounts of control and stability, but sometimes that costs us our ideal anatomy. And those are all trade-offs that occur, I think, at high levels of athletic performance.
Sure. Yeah, I just figured I'd go over the most extreme example of people walking around there.
Yeah, absolutely. And and I think there's also, we can't dismiss the influence of the structure that we're born with, right? There's certain people that are going to be biased towards being really good at gymnastics based on their shape. Yeah. Compared to other people. Yeah. And I don't have the shape of a gymnast. So I could try forever to be a gymnast. I'm not going to have that torso and pelvis combination that allows me to be explosive in that way. And some people do. So, I think it's a combination of their compensatory strategies and what they're born, the structure that they're born with and develop. And I'm sure you've seen this too. It's like, gymnasts and dancing, what's the common thread there? They start very, very young.
Yeah.
Right. Yes. Why do they start young? Because that spine and that skeleton are movable still. They're moldable. And you can absolutely change the shape of those bones. And the earlier you start it, the better. Right. From their perspective, if the goal is to optimize shape for gymnastic performance or dancing performance.
Yeah. And I suppose it is kind of like off topic, but it is interesting watching young athletes develop. I'll have my wife and I will have dancers, gymnasts, whoever come in, call it dancers and gymnasts. And you may not see them for a month or a few months, and they come in and you're like, holy cow, what happened? And you start seeing the biomechanical changes. You see increased lordosis. You see insane upright posturing, almost to the extent that their weight is shifted posteriorly and backwards. Yep. But it's almost within like a month's time. It's a huge shift that can occur in those young athletes.
No doubt. And, that's to their advantage if the goal is to attain a certain position and control. The disadvantages, of course, are those tissues well adapting to those positions.
Yep. Which is why they come and see people like us.
That's right.
Yeah.
That's right. Yeah.
At least the very competitive ones, but
correct.
So then the thing that was most interesting to me, I got a few things that are super interested in, but talk about with breathing. A lot of people don't know what the diaphragm is and what happens when that diaphragm pushes everything down.
Right. So we have two diaphragms. We have a right one and a left one, right? And those sit underneath. And the reason I bring that up is most people think they just have one, but we actually have two.
That's true.
Yes. And, a common myth, in my opinion, is that people say, I need to breathe with my diaphragm. You need to diaphragmatically breathe. And I think that's a really big misnomer because you can't breathe without your diaphragm. If we were to sever your phrenic nerves, right, which control your diaphragm, you would not be able to take a breath.
That's true. Yeah.
Because the diaphragm, think of the diaphragm like a plunger. So when you breathe in, the diaphragm descends, it goes down, and that changes the pressure dynamics between outside the body and inside the thorax.
Yep.
Right? That change in pressure causes air to flow from high to low pressure.
Mm-hmm.
Right? So it goes from higher pressure relatively outside the body to relatively lower pressure inside the body as the diaphragm contracts and descends down into the abdomen.
Mm-hmm.
As we exhale, of course, that reverse in the diaphragm relaxes. So an inhale is the active part for the diaphragm, and the exhale is the passive part for the diaphragm. What I see a lot of in my clinic, and I see a lot of kind of complex physical kind of pain and somatic syndromes. And one of the things I see a lot of is functional GI disorders. So people come in with abdominal pain or constipation or diarrhea or acid reflux or hernias, hiatal or inguinal, diastasis recti, all kinds of different, what I would lump together as functional GI disorders.
Sure.
And one of the things that we see is that when you breathe in, the diaphragms come down into the guts. And we got a whole lot of guts in our abdomen that are folded up and curled and curved all to fit in a very small area, mm-hmm. right? Well, when we breathe in, those get compressed even further. And they have to move to accommodate that descending diaphragm. What we can see though is problems arise when that descension is for some reason limited. So if I've had, for example, an abdominal surgery, and we know this, there's quite a few compelling studies that show that if you've had an abdominal surgery, something as simple as a laparoscopy, then you will have a reduction in the movement of your organs postoperatively. And I don't mean just like 1 week or, a month after, I'm talking years even after.
Because of scar tissue?
Well, so the theory is scar tissue, right? I would also argue that there's a neurological change that occurs. Because think about it, if I'm breathing 20,000 times a day and my diaphragm is pumping my guts up and down, well, now if I've had one or more open wounds into my abdomen, I'm not going to want that big massage of the diaphragm every 5 seconds.
Yeah.
So I might change and orient my torso. Maybe I tip the ribs forward. Maybe I compress one side or the other if I've had more of an injury, or a surgical, injury on one side versus the other, to reduce the amount of pressure that diaphragm is putting on my organs.
Yeah.
Over time, though, that creates an increase in load on one side or both sides of the body because now I'm avoiding moving those organs. And those organs embryologically, morphologically need to move. So if I can't get those to move over time, I'm changing the forces and pressures across my guts, which is just a series of open tubes.
Yeah.
Right. So what I always talked about with my clients is like, look, if you have a garden hose and you squeeze it or kink it or wrap it up in different ways, do you think water is going to flow differently through that hose? Right.
Yeah. 100%.
Well, why wouldn't it affect how our urine and bowel function occurs?
Yeah.
Right. So, the liver, for example, which sits on the right side underneath the right diaphragm, although it does come across the midline and come a little bit underneath the left diaphragm as well. It's a huge organ. People don't realize how big it is, 5 to 6 pounds on an adult. That has to move down and rotate to the left every inhale to accommodate that movement.
Oh, I didn't know it rotates.
It does rotate. Yeah. If you look at it embryologically and you look, there's some cool studies that look at, CTs, with max inhale and max exhale, it comes down and rotates to the left.
So when you're looking down, it'll rotate counterclockwise.
If you think about a marker, if you put a mark underneath your right rib cage, as you breathe in, that mark will go down and be relatively closer to the left. It will come towards the midline. So it rotates down, and I guess it would be counterclockwise. Yeah. Okay. Depending on how you're looking at it. Yep.
Okay.
Yeah. If you're looking at it from the top, it would be counterclockwise.
Okay.
So that occurs every breath. Well, if I've got, and this is, I'm sure that in your world, you see this a lot too. If I've got an inflamed liver, a congested liver, which, a non-alcoholic fatty liver disease, which is, all of these things are rampant in kind of our toxified modern world.
Yep.
Then, there's the nutritional component and the lifestyle component that definitely should affect it. But what about breathing?
Yeah.
It would make sense that if anyone's held a liver, right, they are spongy and dense and they need to be moved. They need to be massaged. And if the breath isn't doing that, we're going to have, I think, it's going to contribute to some of the lymphatic drainage and, kind of liver issues that we see.
Man, that is huge.
I think it's huge. I think it's huge. And, in my experience, when I work with clients who have these kind of functional GI issues, and, a lot of them are also working with functional medicine or nutrition and doing really good work with that. But when we get those viscera moving and moving in the right positions and orientations, we really see some positive gains.
Oh, man, that is just so huge. I'm
and
about
think
to go
about
down
this.
the rabbit hole.
Well, and think about this. Here's one more thing to think about. So your vagus nerve, right, which is huge in the, it's really, thankfully, it's becoming much more mainstream, as it should. It's an amazing nerve. Yeah. But, 2/3 to 3/4, depending on what study you read, of vagus nerve signaling is from the gut to the brain. And it is innervating everything from the lungs, innervates everything from the inner ear all the way down to the lungs. But in terms of the viscera, it's innervating all the organs up to the hepatic flexure of the colon. Every breath is a massage and a signal to that vagus nerve. We are mapping our brain is mapping our gut too, right? And a lot of those signals that are coming from the gut up to the brain are telling us about metabolic demand.
Wow. Right? That's another, geez.
Right. So if I'm not getting appropriate stimulation across the gut, then I'm not stimulating vagus nerve.
Right.
Everybody wants to hum and gargle and those kind of things. And those are great. I'm a fan. I advise people to do those too. But we also got to stimulate all those nerve endings in the GI system. And what better way to do that than getting the viscera to move better and, getting the diaphragms to descend.
Man, I'm telling you now I'm just going through my patient list. I'm thinking about all my IBS. I'm thinking about all my SIBO patients.
Yep.
And how I probably have not harped breathing enough.
Yep.
Of course, we're all doing vagus nerve exercises, like you had said. For everyone not listening, that vagus nerve, it controls all the organs, and you can exercise it just like any other nerve. And one way to do it is, it sounds goofy, but you can sing, you can hum, you can gargle. There's weird things like you can gag yourself, and there's other stuff. We won't go down that road.
Sure.
I mean, it completely left me. I don't even think I remember the last time I heard vagus nerve stimulation with pressure. That may have been 9 years ago, 10 years ago. Yep. That is huge.
I would agree. Right.
Oh my gosh.
Yeah. Okay. And think about too, when you're talking about things like SIBO and IBS, a lot of those there's an influence of valve dysfunction.
Yes.
Right. So pyloric valve, ileocecal valve. What's coordinating those?
Vagus nerve. Yeah. Vagus nerve.
So those valves are either too tight or too loose. Esophageal sphincter too, right? And acid reflux.
Yeah.
So, and think about this too. One other thing is that, a hiatal hernia, which is basically when the stomach pushes up underneath the diaphragm, right? Well, there's your answer right there. We want to give people proton pump inhibitors and antacids for hiatal hernia and acid reflux. But what about pressures?
Yeah.
If my organs are under excessive amounts of pressure because my because I'm not breathing and I'm not getting proper expansion and compression rhythmically, then I'm going to push fluids up or down.
Yeah. And that brings up a really good point, because one of the most common GI issues is acid reflux or GERD or whatever people want to call to that point. And one of the causes that really can go overlooked is a hiatal hernia.
Yes.
And probably once or twice a week, we're sitting there in our office manipulating the rib cage and particularly the lower rib cage and upper abdomen to get that hernia to come down.
Yes.
And to an extent we can fix it, or if not, we can completely fix it.
Which I think is amazing. Right. And I've seen the same thing in my practice too, but it tells us that this is the point I'm trying to make, is that this is a movable, mobile system. It's not rigid, right?
Yeah.
We take an MRI, you get it, you know, somebody gets an MRI or an X-ray or a CT scan, and that is only what their system was doing at the very moment that picture was taken.
Yeah. That's true.
It's like, I look through my phone and there's pictures that I look really good and there's pictures I look really bad. Are any of those an accurate representation of me? They're just an accurate representation of me in that moment that the photo was taken.
Right.
But this is a dynamic system, right? And so things move and can change. And I think that that's a really important message for, I know you know this, and I'm sure your clients do too, but for the listener out there, it's like, your system is dynamic. Things can change if given the right stimulus.
Right. So on the note of abdominal organs, anything in particular about other forgotten organs like the pancreas, the spleen?
Well, so one of the things to think about with this, so all of them it's all affected, right? Everything is affected, whether it's, spleen, pancreas, small intestine, large intestine. Don't forget about the gallbladder too, right? I mean, gallbladder is one of the most common surgeries.
Yeah. And man, and I'm not judging people for getting it, but oftentimes that it can get taken care of. You don't have to have that out. Right.
We'd like to see, all conservative measures kind of exhausted before. And unfortunately, that's not always what happens.
Yeah.
But all of these organs respond to rhythmic movement. I mean, if you think about the pancreas, it's both an endocrine and exocrine gland, right? Mm-hmm. And so if you've ever held a pancreas or looked at a pancreas, which probably most of your listeners haven't, but you may remember from some of your anatomy, it's movable, it's mobile, right? And so if I squeeze something, stuff's going to come out of it if it's a gland on some level, right? So movement needs to occur through that system. And the spleen is really important because of its influence on the anti-inflammatory system via vagus nerve.
Yeah.
So, Vagus, Vagus really influences splenic function and its role in the anti-inflammatory process of proper vagus nerve function.
Sure.
So,
go ahead.
No, that's all I had. Yeah.
Gosh, all that is just so huge. So then something that I just thought of is the concept of hysteresis in the low back. So, at what a lot of people, this is what I was taught in school, and I don't know if the jury's out. So when we were going through school, even before we got to school, I was taught the discs, particularly the low back, are the shock absorbers of the spine. But then you read books from like Stuart McGill out of Canada, and he's talking about how these things are hydraulic in nature, and there's not a lot of give in these discs. It's more so the bony matrix of the vertebra that create a sponge effect, if you will. I'm sorry, like an up and down effect. And then with that, what a lot of people don't know is there's not a lot of good blood flow to the spine. So the way the low back is said to get its nutrients is basically water, and nutrients will seep through the bones and in through the discs. Is breathing part of that process to create the correct pressures?
Yes, absolutely. Because if I am oriented in a position of rigidity or compression or restriction, whatever you want to describe, however you want to describe it. So let's use the example of the gymnast that we used earlier. So if I'm really extended, my back is extremely arched. Well, then I am going to have excessive amounts of compression on the back of the spine, and I'm going to have more relative opening on the front of the spine, right? Well, that pressure squeezes fluid out, right? Because fluid moves from high to low concentration or high to low pressure.
Yep.
So if I'm squeezing it and I'm not getting the rhythmic, if my diaphragm is not moving down, but is instead moving forward, relatively speaking, then every breath compresses my back more.
Got it.
So I'm not getting the rhythmic pumping, right?
Yep.
And I think about this, I really liken this to the analogy of ocean life, right? So if you've ever gone to the beach, there's this kind of wave, or, the tide comes in and comes out, right? The waves come in and come out. And sometimes they come up the beach, and then after a while they come back down the beach. But they're always, the waves are always lapping forward and back. That is our primordial beginnings, right? And we still have that function in the body, right? This long tide or this oceanic kind of movement. And I believe that breathing is one of our kind of oceanic or primordial movements. And so if that's not coming up and down, if that's somehow distorted, either by a limited motion of the diaphragm or excessive amounts, then that is going to influence that movement of blood and nutrients in and out of the discs and all joints. The same thing happens in your teeth if you are clenching your jaw all the time. If you clench your teeth all the time, obviously you're going to break them. Why are you going to break them? Well, you have high pressure. How do nutrients get into the teeth? They seep in.
Yeah, that's true.
Both from the outside, so the acid base content in your mouth and your saliva and all the minerals in your saliva, but also from the roots. Well, if I'm clenched the whole time, nothing can move in because pressure is too high.
Yeah.
Right. It happens in our shoulder joints and our elbow, all of our joints depend on these same things. And so, when we're stuck in one position and we can't move in and out of it, we're going to see problems over time.
Man, golly, just love it. Well, let's talk about above the diaphragm. What happens with the lungs and the heart?
Yeah. So every time so as we breathe in, that diaphragm goes down, the lungs have to expand, right?
Yep.
And they fill from the bottom up, like filling up a glass of water.
Mm-hmm.
So if you think about lungs are biggest, they're broadest at the bottom and they narrow as they come to the top.
Yep.
Well, if I'm not getting proper diaphragmatic movement down into the guts, then I'm not going to fill the lungs as easily and as well. What that's going to do is that's going to, of course, influence oxygenation, because if there's most blood flow at the bottom of the lungs and the lungs are broadest at the bottom, but I'm only filling partially up, then I'm not getting as much delivery of oxygen into the blood. Right?
Absolutely.
And the same is true, because we're continuing to talk about this kind of pressure model, some would call it like a hydrostat type model, then you're going to have issues with, potentially the heart too, right? And I don't mean necessarily rhythm problems, but you can get compression and changes in movement across the heart because it has to move to accommodate those lungs as it's tucked in, for most people underneath that left lung. So it's going to influence all of that, all those positions. One of the things that happens a lot too is that we tend to, in a compensatory strategy, we tend to compress the sternum down. And so if you look at an extreme example of people who have that pectus excavatum, like the caved in chest, right? Think about what that does to pressures across the rib cage. That is an extreme example of a smushed lungs front to back.
Yep.
So if I can't expand front to back, well, then I'm going to have to accommodate elsewhere. And what you'll often see is people will have to bring the head forward.
Absolutely. Yeah.
Because if my sternum is smushed down, I'm trying to lift the rib cage with a breath in.
Okay. I guess I never wondered why the chin would come forward, but now that
there's a variety of factors. There's a variety of reasons that a head could come forward. But if we think about it from the bottom up, think about what these two muscles behind the ears connect to. These are called your sternocleidomastoids, right? Sterno meaning sternum and cleido meaning collarbone. When they contract, they approximate these two positions. So if it's contracting, it's going to bring my head forward, sometimes in an effort to lift the rib cage up.
Got it. Which brings up that concept of what was taught by us or taught to us as muscles of secondary breathing muscles or
Right.
accessory
muscles of respiration.
accessory muscle.
Yeah.
Yes.
Yeah.
Well, let's go over that because we're talking aches and pains. And if you're not breathing right, then people are going to have all these issues with their chest, upper back, neck.
Right. Well, I think that, so my take on it is this, is that if you do not have appropriate diaphragmatic orientation and position, meaning the diaphragms don't move down, they move forward, relatively speaking. So they push forward rather than moving down because I can't control the movement of my guts.
Yep.
Then what's going to happen is I don't have appropriate intrinsic stability of the thorax and pelvis because I don't have appropriate abdominal function. So one of the ways that I'm going to help provide some stability and get movement, if I can't have it from down there, is I'm going to get it from my neck. So I'm going to squeeze with those neck muscles to help me feel something, help me feel stable and more controlled. And that's going to often create a lot of compression across these very delicate structures in the neck. Right. Your first rib, as I know you are well aware, comes, all the way up to the base of the neck. Underneath that first rib is the totality of our airflow and the majority of our blood flow.
Yeah.
To and from our head.
Yeah.
If that is getting squeezed, all the muscles that attach to it, then I'm going to really compensate in an effort to try to get more air, because I'm going to always prioritize airflow and then to a lesser degree, or I would argue, blood flow. Yeah. Right. So we're always trying to get that. So if I'm using my neck to help me breathe, that is a really inefficient process with a short shelf life.
Oh, yeah. And so then that kind of brings up, or at least where my mind goes with all of this, is not only the neck tension and upper back issues that come with it, but headaches. Tension-based headaches, migraines, a mix of the two. When we simply have someone in office learn to take 5 to 10 minutes, lay prone to work on some mindful breathing, and I'm sure you can validate this. When we lay prone, we tend to breathe better with our diaphragms.
So think about why that would be. Right?
Because of the pressure on the front.
That's correct. Because now I have a solid constraint on my abdomen. When I breathe in, my diaphragm has no choice but to go down. Yeah. And I got this spine, I got a bony spine and a rib cage on the back that I don't have on my front, my abdomen.
Yeah.
And so you're absolutely right.
I've never thought about why. I just knew that it does work. Yep. It's just one of those things that you learn it, you take it as the clinical pearl and you run, and you don't think about why. But
sure.
But when we have people just do that, and I'm not even thinking about all these other 89,000 details you just went into.
Sure.
That alone can start knocking out headaches.
Absolutely.
As just something simple to do.
Well, right. And I think, too, we have to keep in mind that headaches are multifactorial, but ultimately, what does every cell really need? It needs to be able to deliver blood. That blood has to have oxygen. That oxygen needs to deliver electrons to create energy, to split water or make water, and to create CO2.
Yeah. And
then I have to be able to shuttle that CO2 out.
Yep.
Keep it at the right amount, right? Because if I have too low or too high, I got problems too.
Yep.
Right, which is going to change respiration. Because by the way, keep in mind that CO2 is really what drives respiration, not O2. Until you get below, I think it's like 80% oxygen saturation or something. Certain altitude, then low oxygen will drive respiration. But CO2 is what drives it. Yes. So if we think about that in terms of the head and neck, think about the demand of the brain for blood flow. I think it takes I can't remember the exact number, 10 or 20% of all blood flow is constantly going to the whole body, is going to and from the brain.
Well, it takes 20% of our metabolites, calories.
Right. So it's a high demand, it's a high output engine. If it's not getting blood flow in order to move oxygen and CO2 out, we're going to have problems. And, headaches or pain is merely a signal of danger. Right? Danger, danger, danger. We're not getting appropriate fuel substrates
Mm-hmm.
right? To make energy and help you think. And so we're going to produce this pain. So you start paying attention to us.
Right. Go into breathing in general. You just talked about CO2 as what is going to dictate breathing, because breathing is more or less a feedback mechanism, unless we're cortically consciously taking over. It's ruled by CO2, like you said.
So that's the cool thing about breathing, is that it is both conscious and subconscious. And the reason I think it's a really important influence over the stress response is it's one of those few things that we can both consciously and subconsciously control. So it's that kind of link between the conscious and unconscious or subconscious, right?
Yeah.
And so, we have receptors in our brainstem for carbon dioxide and oxygen and pH, acid-base balance, all these different things. We have all kinds of receptors, including in our cerebral spinal fluid. And the brain is trying to always keep all of those markers in balance. And what happens, though, is when we are chronically in a state, for example, of hyperventilation, so breathing more than we need to for a given task, what we tend to do is blow off or exhale too much carbon dioxide. So the carbon dioxide levels get lower.
Mm-hmm.
And the brain stem, this part of the brain that's sensing all these different markers, gets more sensitive. It gets trigger happy, which creates this feedback loop where I breathe out more than I need to, which signals me to breathe more, which then lowers my CO2, which raises all that stuff. And keep in mind that those areas of the brainstem feed right up into the danger centers, or the kind of warning centers in our brain. I'm simplifying here a little bit, like the amygdala and the limbic system.
Yep.
That then feed forward into a kind of panic type state, right? Or more of an anxiety state.
I was about to say, then this is basically anxiety physiology 101.
Exactly. So, think about traditionally, and we don't see many people do this anymore, but if you remember you'd watch an old 80s or 90s sitcom or something, and someone would be having a panic attack and they would give them a brown paper bag to breathe into,
mm-hmm.
right? Why are they doing that? Because they're having them breathe back in their own exhaled CO2.
Yep.
Which transiently raises the carbon dioxide in their blood, which helps calm them down.
Yep. Which it's true. It works. It's just physiology.
Right.
And it's beautiful. As a matter of fact, we were working with a traumatized patient, and right there in office had a panic attack, and had a good thing. She had a little brown paper bag on her, and
Perfect.
used it. And it was actually a learning experience for me. So I just ordered some off Amazon to have them around.
Yeah. Yeah. They're cheap things, we used to have them around all the time when we would take them in with our lunch, but,
Oh yeah. Yeah. No. Now, don't do that anymore, because everything's fancy and it's got its own ice pack built in and all that stuff. So
that's right.
Yeah.
But yeah, so the breathing is really connecting both conscious and subconscious. And so, if we're aware of these connections, then we can start to make different choices about being intentional with our breath, the positions that our body is in, so that we can optimize, these factors.
So then, let's kind of go over things you look at, or things that other people could even identify in themselves with posture or things of that nature that could indicate an aberrant breathing pattern.
Definitely. So there's a whole host of things that folks can do. I actually would start at the top. So the number one thing that I always want people to understand is, are you breathing at rest through your nose or through your mouth?
Yeah. We haven't even, you could do a whole show on just breathing in through your nose.
We could, yes. But if you think about this, right? So if I'm at rest and I'm breathing through my mouth breathing is a stress response. So when does any healthy animal breathe through their mouth? Only when they are hot, like a dog's trying to cool themselves off, they're sick, or they're sprinting full out, like you might see in the Kentucky Derby.
Yep.
But all mammals, including humans, should, at rest, breathe through their nose with their lips sealed and the tongue suctioned to the roof of the mouth. So, for the listeners that are listening to this at home, when you're, stop what you're doing right now and ask yourself, how am I breathing right now as I'm listening to this?
Yeah.
If your tongue is shoved at the floor of your mouth or between your teeth, right? We see a lot of that where they posture the tongue in between the teeth. What that leaves is if you open your mouth and look in the mirror and you see those little indents called scalloping.
Yes.
That is because you are shoving your tongue against your teeth and not up to the roof of the mouth.
Got it.
What that creates then is certainly postural changes, also, blood gas changes as well, because we don't oxygenate as well mouth breathing as we do tongue, nasal breathing.
Mm-hmm.
But it also changes cranial nerve function, right? The signaling to the nerves up into our brain. Our face is full of all these nerve endings that tell us where we are in space and what we're doing with our mouth and our jaw.
Yeah.
If that's aberrant, then my brain is going to be getting distorted signals, just like it does from the gut when we have distorted breathing.
Yeah.
So that's where I start with people is what's your mouth, what's your tongue, lips, and jaw doing?
Got it.
And then we just work our way down, right? If you look in the mirror and you look at yourself breathe, do you see your neck contract and light up every time you take a breath in? If so, yes.
The shoulders come up.
Yeah. The rib cage should expand forward and back and side to side.
Mm-hmm.
It should not lift up with a normal breath.
Yes.
I'm talking like a normal at rest breath. It's normal for that if you're really, really exerting to have a bit more of a heave. And the belly should not protrude out forward as much as. So I think one of the misnomers is like, this deep belly breathing. Well, what should happen is that you should have enough abdominal intrinsic automatic function that when you breathe in, the diaphragm goes down. If the belly is pooching out, and the example I always use is like, these very thin, like some, women who do yoga, for example,
mm-hmm.
and you'll have them take a breath in and their belly will just go straight out. Like they looks like they're pregnant or bloated, right?
Yeah.
Even though they're not.
Yeah.
That is unopposed diaphragmatic action that is pushing things forward rather than down. So what you'll often see is that the rib cage is actually not getting much expansion in that situation. So the bottoms of the ribs are flaring open, but the upper rib cage is not opening.
Got it.
So they're not getting that proper expansion compression or expansion contraction.
Yeah. So essentially it's got to be coming from the lower rib cage.
You mean in the instances of the like the belly pooching?
Yes.
Yes. Yeah. We want the entire rib cage to move open and close.
Yep.
Like a billows.
Yep.
Right? Not just the lower ribs or the, upper, or just lifting the rib cage.
Right. How about something I know that we keep an eye on because it's something that when it's ingrained in your head, you just can check on everyone. If they're standing or supine, man, if I see a belly that just sinks right in, and there's just nothing there, that tells me that I know that things are not getting pushed. Of course, I'll see the rib expansion across the board with that person, but it's almost like that. Not only is that belly flat, and this person can be just very, very skinny, but it is just sunken in. Like there's just nothing there.
Yeah, so that might be a diaphragm excursion problem. So maybe the diaphragm's not moving in as much as it should be. We would also want to look at the position of their pelvis and what their lower back is doing. Sometimes that's a abdominal tone problem. So maybe they have really poor abdominal tone, and I don't mean tone like they should walk around and squeeze their abs like they're trying to have a six pack, but they functionally they don't have any control of that core.
Got it.
And it's interesting in my experience, those folks tend to, when they were kids, babies, little kids, not do very much crawling, and be sometimes, if you ask their history, they'll oftentimes have a history of like, I had to have OT because I was low tone, or I had, I was always hitting my milestones a little bit slower.
Yep. And that's the majority of our patients are kids with needs, and we'll see them. I'll see that all the time with kiddos. So with kiddos, we definitely get on their breathing, but we definitely got to do more. But with that, you had mentioned something earlier that really clicked with me, and that was when you breathe out, I'm sorry, when you breathe in, you're pushing your abdomen down, and that is allowing the vagus nerve to fire, which is then the vagus nerve is then giving feedback and telling that brain where those guts are.
Correct.
Because most of the time, for all these parents and or people listening, children with special needs outside of learning disorders like dyslexia, throw that aside for a second, they don't feel their bodies.
Correct. Absolutely.
Which is a complicating factor to all of this, but
well, I think, what it means to me is that they are not, here's how I describe it to folks. You need an accurate map to move through the world. If you came in, I live in Atlanta, it's a big city. If you flew in and I gave you a map with just, the highways, you could get around okay, but you're not, if I say, meet me at, this restaurant, you're going to have no idea where that is.
Yeah.
That will be very stressful for you.
Mm-hmm.
Right.
100%.
So what we want is an accurate map, because when we have a more accurate map, we can better use resources. I might find that restaurant, but I'm going to drive all over the city trying to find it. If you give me a detailed map, I can go right there.
Yep.
And I think that, our job as therapists, chiropractors, doctors, whatever, we are, is to help give our patients a clearer map.
Yep.
And so, and a more accurate map too. And so, breathing is a great way, because we do it so many times a day that even just putting a person in a specific position, teaching them to breathe and fill and unfill, or, empty, fill and empty in those positions, even if it's 15 breaths a day, can make a profound difference in a person's understanding of where their body is in space.
Man. Well, and I'm kind of all over the place, but something I got to get out of you is, you had talked about teeth earlier. And what's fascinating is I think a lot of people have a lot of mouth work done. It's hard for me to think of one person that just has not had copious amounts of work done in their mouth.
You mean like dental work, crowns,
yes.
root canals?
Yes.
Cavity fills.
Let's talk. Yes. Especially cavity fills. Let's talk about how breathing affects that. Because
boy,
that was a big one when you went over that in the presentation.
Yeah. So I think there's a lot of different factors at play here, right? One is the occlusion. So how the teeth touch. If we have a malocclusion, which most of us have, right, we're going to hit teeth excessively on one side more, right? That's going to affect nutrient and fluid flow within the tooth, as we discussed earlier. Mm-hmm. But also, if I'm breathing through my mouth, I am making the mouth more acidic. I am drying the mouth out. And remember, a lot of the minerals that maintain our tooth health come from our saliva. Yep. So if I'm breathing and moving air across the mouth, I'm dehydrating the mouth, I'm drying out saliva. Therefore, I'm making the tooth drier. Therefore, I'm not remineralizing the tooth. There is a strong correlation in the literature between mouth breathing and dental decay.
Yeah.
There's also a strong correlation between mouth breathing or, low tongue posture and mouth development, right? Because the tongue up to the roof of the mouth and lips sealed creates equal forces across the teeth. So the forces pushing in on the teeth equal the forces pushing out on the teeth. And so what we get this nice forward and lateral development or growth of the palate. And that allows for more room for the tongue, which then allows for a bigger sinus cavity and nasal passages to allow us to breathe through the nose.
So mouth breathers could be people, unfortunately, that may have a mouth or a jaw that looks narrowed
and high. Yep. Mm-hmm.
Got it.
And then, of course, our dental procedures only tend to exacerbate that, right? We pull teeth or use headgear, which is what I had, which was awful. Or, lots of constrictive braces. And they're trying to make the teeth fit together, but they're not asking the question of why don't these teeth fit together?
Yeah.
Right.
Yes.
And it's often because of the position and orientation of the tongue, lips, jaw, and I would argue the rest of the body. So a lot of my work that I do with clients is in concert with dentists that are great. They're really forward-thinking dentists to get the rest of the body in alignment so that when they go get this dental work done, they're in the right positions.
Yes. And In earlier I'd mentioned, breathing through the nose, and also just now mouth breathing. But something important about breathing through the nose is a couple basic things that at least I know of, and I'm sure you know a lot more, is it filters the air. So that's good for all sorts of things on top of in today's world we live in with pandemics going on. But it filters it, it moistens it, and it warms it.
Yes.
Which are all important, but are there any
it
other?
It tends to slow it down too.
Okay. Yeah.
So when you slow it down, the diaphragm has more time to descend into the abdomen and come back up.
Yeah.
And also, because of slowing it down, it allows those molecules to mix a little bit more. We also produce nitric oxide in our paranasal sinuses. When we mix that air and we have time to mix it in the nose, then we're also improving the vasodilatory effect. Nitric oxide is a vasodilator.
Yeah, and it's vasodilator, which is obviously needed for all sorts of things, but people with issues that involve small blood vessels. So where the smallest blood vessels are, i.e. your hands, your feet, your brain, your eyes, and elsewhere, if you have issues there, it can be related to breathing.
Absolutely. One of the best ways to know, one of the screens that we look at for folks to know if they have breathing issues is, do you have, the screening questionnaires I have is, do you have cold hands and feet or a cold nose?
Oh, that's right. Yeah, because it means you're not oxygenating as well as you could.
That's correct.
Yeah.
Yep.
Yeah.
Yep. And you're blowing off more CO2, which has a vasoconstricting effect.
Yeah.
So you're getting a double whammy. You're not mixing with nitric oxide and you're not maintaining appropriate levels of CO2.
Yep. Just a twofold effect.
Right.
Now with the jaw, I can't remember if it was just something you had mentioned just today or even in your presentation, but with proper breathing, do you think that could help contribute to people needing less work, like braces and headgear?
Well, I think if you look at the work of Weston A. Price,
oh yeah, forgot about him.
Who really looked at indigenous peoples and the size of their palate, the straightness of their teeth, and you compare it to our kind of world where we have crooked teeth, small mouths. His argument was that it was largely fat soluble vitamins and minerals that were playing a role in dental arch development, which it's hard to argue against that. And there's studies that would, agree with that now.
Yes.
But I also would say that I think it's multifactorial. And one of the things that happens when we're missing these appropriate nutrients and minerals is we tend to get more inflamed. When we're more inflamed, it's harder to breathe through your nose.
Just another safety pin cycle. Right.
So I think that, yes, in my opinion, and I don't have a singular study to show you, but there's growing amounts of, we're kind of waking up to this more and more. Yeah. I think if you could create the perfect kid in terms of oral facial development, you would have, obviously a mineral and vitamin rich, whole foods, chewy foods diet, but you would also make sure that child is breathing through their nose. Their tongue is up to the roof of the mouth. Their lips are sealed. They don't have a lingual frenulum. They're not tongue tied. Their fascia is moving well. I think absolutely that would allow for straight teeth.
Yeah.
And if you look at the population, I mean, if you ask people who come in the rare instance that you would have someone that would come in with straight teeth and they didn't have braces, you will see a resting posture of nose breathing.
That I'd agree 100%. I know that was kind of a hard question to answer. It's just trying to let people know that, holy cow, this can just affect anything.
Absolutely. I mean, I wish my parents knew this when I was little.
Yeah. Oh man, 100%.
Right.
So I guess we kind of got to wrap up, but something that we pay attention to in our office are, like a lot of people, are vital signs. And it's maybe up in the air, but what should be the respiratory rate for called an adult?
Yeah. I mean, the traditional kind of normal tidal ventilation rate, if you look at your typical textbook, is anywhere from 10 to 18 or 12, even sometimes 12 to 20.
20 breaths, yeah.
which is a lot per minute. That's, by the way, that's per minute. I like my folks to be at ideally 10 to 12.
Yes. And I'm 100% agreement there. I think that we breathe too much.
Ideally, you would be taking a breath about every 5 seconds.
Yeah, which is crazy to think when if you do think about that, a breath every 5 seconds. But I think it should be that way. So then, any other tips or tricks, things that people can do? Like, we got patients laying face down. Of course, we manipulate and adjust and do our thing. What are other things that people can do for themselves at home to work on their breathing?
You know, this is going to sound a little bit out there perhaps, but one of the best things that you can do for your breathing is to lay on the ground.
Love it.
Lay on the ground and move in different positions. If you're going to watch TV, lay on your stomach, then lay on your side, lay on your back, you know, sit in different positions, but get on the floor. And the reason I say that is because that provides a constraint that causes potentially a positive change in your breathing pattern. Yeah. When we sit on these malleable surfaces all day, cushy chairs, cushy couches, cushy beds, what happens is that we just adopt the position of most ease for breathing.
Yep.
Because there's no constraint on the rib cage. So the rib cage just goes where it wants to go. But if we lay on the floor and do some different, you know, in different positions, don't always lay on your stomach or always lay on your back, move around, roll around, side to side, front and back. That changes the shape of your ribs because gravity is pushing you down and your body has to accommodate on the hard surface. You literally kind of smush out like a water balloon.
Yeah, because there's no give.
We want your body to give.
Yes. By
changing positions. So I just recommend people get on the ground more.
Love it. How about bands? One thing I was taught was having a band around the diaphragm and work on breathing.
To, like you're saying, to provide a little bit of resistance, so you breathe into that. Yes. I think that has some indications for certain people. I would say that it depends on their pattern. For some people, bands might be problematic because they tend to push out and overinflate to try to expand that band, or it might be too much. I think it has some merit, you know, but again, it's context dependent.
You know, I like the whole ground thing because, not to get into people's beliefs or anything, but for a lot of years, we were walking this planet with nothing cushy, not sleeping on anything very nice at all. So I think our genes are very used to having us on hard surfaces.
Look at your dog. Watch your dog on the floor, right? When he sleeps, he doesn't lay there for 8 hours in one position because it's uncomfortable after a while. So he has to change positions. What does that cause over time? A dynamic breathing strategy.
Yeah. Rolling.
He expands one side, then he rolls over, he expands the other side. Then he lays on his, you know, stomach and he expands the back, right? And when we sleep on these really soft surfaces or sit on these really soft surfaces, we never change because we never get that stimulus.
Yeah. Which now, I mean, you could just go into a whole topic about sleep hygiene on that note. I mean,
oh, sure. Yeah.
Jeez. All right. Well, anything else you got for things that people can do?
You know,
places to look into, websites, whatever.
Yeah. I mean, I think the other thing I think an easy place to start is breathe low and slow.
Love it.
You know, and what that means is just every time you take 5 minutes, and when you breathe at the end of your exhalation, so the end of your exhale, pause for 3 seconds before you breathe back in. What that will do is allow your diaphragm to come back up underneath your rib cage a little bit more. And then your next exhale will allow it to come back down. So it pumps more up and down. So that post-exhalation pause, really helpful. It also stimulates vagus. We know that an exhale and pause tends to increase vagal activity, which is anti-inflammatory and all the stuff that we talked about. So just slow your breathing down a little bit. It's okay to feel an urge to breathe faster. You don't have to give in to that urge.
Right. Yeah, it's a good reminder to slow down and just remember there isn't a tiger after you.
Absolutely. Yes. Yes.
Awesome. Well, do you have anything else for everyone? For everyone in Atlanta or otherwise, where are you located? How can people find you?
Yeah, so like I said, I have a practice here in Atlanta. I'm technically in the Brookhaven kind of area, but I see people from all over the city and all over the state. And I have some people that come in from out of state as well. And, I've got a website at sethoberst.com. And then you can find me on social media as well.
Cool.
Using that name. So yeah.
Well, now we got another name for someone to send people to in Atlanta.
That's right.
We have some friends out of Atlanta, and the first thing I think of Atlanta is Peachtree City. I want to go and ride golf carts all over the place in Peachtree City.
They do have it. They've got it laid out they're pretty sweet down there. It's just like a little golf cart community. It's pretty nifty.
I mean, talk about needing an accurate map. It just sounds like it sounds pretty awesome to try to navigate.
Yeah. It's pretty cool though.
Awesome. Well, thanks again for coming on. It means a lot. Is anything else you got to say? Anything that's popped in your head?
No, I really appreciate the opportunity. And, I hope that your listeners found this valuable.
Oh, I'm sure they have. It hits just about anything. And like we said, we could go into breathing in through your nose alone, and then sleep hygiene alone is.
Yeah. Maybe we need to do a separate another conversation. Cause I think the big thing that, we haven't talked about that probably should at some point is what happens in your airway while you're sleeping.
If you wanted to, I'll have to reach out and just get you on again, because doing a whole episode about breathing in through the nose, and that would be huge. Because after your presentation, I started diving into breathing a little bit more, and then stuff about the airway and nighttime came up, and I was like, oh my gosh, I can't keep up with it.
Yeah, it's a lot. It's a lot. But I think it's, if you can't breathe at night, you got no shot of repairing anything.
Yeah. And mind you, people, those are the people most likely, like, this pillow doesn't work. This bed doesn't work. That doesn't work. Halfway through the night, I have to go switch to this bed, or I have to go climb in bed with my kid, or only the couch works on Saturdays, or whatever it is. And I'm like, oh my gosh, these are people that are having a hard time breathing at night.
They're choking.
Yeah. They're constantly waking up, albeit if like blood sugars and things like that are stable. It's just. Yep, absolutely. Well, I'll be reaching out again and bother you again, and we'll have to go over that. So
sounds great.
Awesome. Well, thanks again. And then if I don't hear from you in the meantime, maybe we'll see you around IAFNR this year.
That sounds greght. Thanks so much for having me on. I really appreciate it.
Awesome. Thanks for being on. Appreciate it. Bye. All right, everyone. The Dr. Alex Show is brought to you by Apex Energetics, apexenergetics.com. First of all, to learn more about Apex Energetics, head on over to that website. If you want to get Apex Energetics directly, please call them 1-800-736-4381, or you can shop our online store. You can get to our online store at myhcpstore.com. Username is Dr. Alex. Otherwise, if you'd like to find a doctor that uses Apex Energetics, you can give them a call or go to the website, and they'll direct you to a doc in your area that should be doing very good work with Apex Energetics. Apex has just been instrumental in our lives professionally and personally. About 6 years ago, we went through one of the most hellacious traumas that you can think of. And if it weren't for Apex with their stress support line of products, I probably would not be here. Point blank, period. And in the office, making the switch from other lines to Apex Energetics has sped up our results with our patients, supporting them through their healthcare needs, probably by 25%, if not more. And when it comes to Apex Energetics, we just want to remind everyone that we are here to not cure diseases, making claims. We're here supporting people, increasing their healthcare needs, and helping them achieve their goals. apexenergetics.com. The Dr. Alex Show is hosted by myself, a nerd, Dr. Alex Nelson. I'm a chiropractor, board certified in functional neurology and childhood neurodevelopmental disorders. The show is available on Apple Podcasts, Google Podcasts, Spotify, or most any of your other favorite podcast apps. The Dr. Alex Show is a production of Fredcasts. Think, Speak, Act.